So let's start with tariffs. There's a lot to unpack here. I think the big question for investors is just what ultimately this means across various industries. For Philips specifically, how big of a challenge or how do you expect to navigate what could be a very uncertain couple of months or several months?
Yeah, I think for healthcare, and we have, of course, been going through several supply chain challenges following actually from COVID, that we also have been working into how we make our supply chain more resilient and agile, because the situation currently is not clear, which means that we need to be prepared to move fast if kind of clarity kind of comes out. But we already have been working in actually making sure we can source many more products close to our customers. So we did that in the US, we have been doing that in Europe, we have been doing that in China. So in that sense, kind of, I think as an industry have been working it. As Philips, this was one of the pillars of my strategy, where we said a reliable supply chain is extremely important to be able to cater to the demands in the healthcare market. And I think that's where we see that healthcare still is under very significant pressure. They need new solutions. So I think the healthcare system needs the solutions that we can offer with AI, with the technology and the innovations that we are launching. But at the same time, we need to make sure we can supply them when they need it and from where they need it.
So what is the financial impact? If we do see Trump then follow through on the threats here of tariffs, what does that ultimately mean for your business?
Really hard to speculate on. At this point in time, kind of we cannot predict. We make sure that kind of we are best prepared for it, and then kind of we have to take it once there's more clear about this would mean for world situation. But as said, I think we have been also working on preparing for a more regionalized and localized setup of our supply chain. And that's both on components as well as finished products. But it's also fair to say that there is, of course, a global supply chain that you also need to keep working because there are not all components available in any country of the world. So there will always have to be cross-border trade. And that's also what we are advocating for because we believe that's of the interest of the hospitals that actually don't need more burden in terms of more supply chain challenges or higher cost. So we need to make sure that we keep servicing them to the best of our abilities with a reliable supply chain.
There are so many factors here that come to mind for me to ask you about, but one of them is some news that we were covering this morning, the idea that Beijing is already engaging in a bit of a tit-for-tat, banning the exporting of rare earth minerals to the U.S., which is utilized in a lot of products. And I think that's just one example of the wide-ranging impact that this tit-for-tat on tariffs could have. What is your biggest concern specifically about what retaliation could look like?
I think, again, it's hard to predict how it exactly will play out. So that's also why we don't kind of waste time on speculating on that, but we focus our actions on how we can get best prepared. And as on one hand, as I said, regionalizing, but also being agile so that we can adapt. We have been showing that kind of we can do that in earlier situations. I also think that the world has shown earlier kind of what supply chain crisis can do to it and how we need to respond to it. So I think we all need to be very well prepared, focus on the controllable parts that we currently know, which is our supply chain and how we have localized that. And that's making sure in China you can source from China for China. In North America, we can actually serve our customers here with North American kind of manufactured goods or supply that actually also comes into the US that actually helps to service them to the best of ability. Because the reliability of the healthcare system is super important. We see massive demand in patient volume that goes up. So there's a very big need to keep that flow of patients going, and therefore supply chains have a very important role to play.
Zooming out beyond the impact of tariffs, one thing I would love to get your take on is kind of how, as the CEO of the company, you deal with just the swings in policy between administrations. You've got 4 years of policy that's completely different coming up here than the policy that we've seen previously. And of course, some of it is a continuation. But how do you think about just the shifting adaptability that you have to have in place given the political volatility that we have?
Yeah, so we have, of course, been working with many administrations, and we have been doing that across our lifetime of 133 years. So we keep very much focused on what is it that we're here for to serve. And if you look to the healthcare challenges in North America, for example, the major staff challenges and shortages that exist to support the patients is something that we keep focusing on with our innovations. And by helping and taking AI as some of the latest innovations to really make sure that you have a more productive healthcare system where you can have, for example, Nicholas Hospital that we support in how they treat their children in a better way, but a better patient experience because it's less time of a scan, where they have a more ambient, friendly experience, where we can make sure that the reporting is done in an easier way with the help of AI. Those are things that we keep focusing on because regardless of administration, that's something we need to solve for as ecosystem. Now, what is important is that you work closely with an administration, and we have been doing that because the ecosystem of healthcare is always how you work the clinical practice with innovations, but also with the regulators and with the administration. So that together you improve patient care in the United States. That's a big topic, high priority for all of us. So that's also what we keep doing. We have very strong ties with the VA, for example, which is a very specific patient population that actually we have been serving and actually looking what can you do in remote access. Many of these patients are not close to hospitals, which means we need to dial up remote care. So we come up with solutions, digital, but also kind of specific hardware solutions to serve them in a better way in where they are. And that's something we have been doing already for many years, very successfully also with the government, earlier also already with Trump administration, and with the administration that is in play.